Good morning, everyone. I'd like to welcome everyone to our Zoom session. I'm Mick Stott, and I'm currently representing veterans and trying to get veterans together so that we can address the current situation. We have the pleasure today of chatting to Mark Oakford, who for me has done a tremendous piece of work that is unique in its own right and also exceptionally comprehensive. Mark, I'd like to welcome you. And if you'd like to give us a few minutes about yourself, Mark, that would really sort of get the ball rolling, yeah?
Okay. Thanks, Michael. I've come up with an idea through a friend who sent some freedom of information requests off. And he sent 17 off to local authorities to ask about stats within their staff, of Covid-19 deaths. He sent 17 off, and the replies that he got were for about 150,000 people, and there was only about 3 deaths. So we were in talks about doing other things to do with kids' education, and it just alerted something in me. So I used to teach people how to use basic IT skills, Word and Excel and stuff. So I'll just share my screen now. 1 second. So I'm able to use Excel, and what I've done was I went onto a site. Let me just close my Facebook down there. I went onto a site called FOI Directory, which gives freedom of information addresses to all these different sectors. So, for instance, if I click in London boroughs.
And of course, Mark, can we just establish something about freedom of information?
Yeah.
Freedom of information is a factual, it's access to a factual level of information that really cannot be distorted or changed, right?
Yeah, it's what it is. You ask a company or a public body for information that you feel it should be public. That goes to them, and then they have a set of guidelines which they have to work to of whether or not they should or should not disclose the information. But it has to go through a government-run body called the Information Commissioner's Office, so everything is absolutely legit. So when I found this website, this has got the freedom of information email address for each of these, and then the city councils, county councils, police departments, fire service. So I collated all these pages together to create a mailing list of 1,392 different government departments, which all got the same request to request data on their staff. And by doing this, what I wanted to do was come up with a big enough data sample to compare against what we're told by the ONS and the NHS statistics.
Yeah.
So therefore, we could get a direct comparison between the ONS published data on people from 0 to 65. But if you consider that people from 0 to 18 statistically don't count because there's been that many children, that few children who died, sadly. But as a statistic, they don't come into the numbers. So we were able to do a direct comparison between the 18 and 65-year-olds by targeting the working age population within the civil service.
Yeah.
So yeah, there was a direct comparison. So the ONS published statistics to say that from that working age group of 0 to 65, if you exclude the children, that's 16.6 people per 100,000 die of COVID-19. So I wanted to gather data to see whether or not these projections and models stood up to actual fact. And the actual fact that I've got at the moment is 700 different data sets from 700 different government departments. So it's government-owned data.
So it's a significant sample that you've got.
Yeah. So what I'll do is I'll start off by showing you the questions that I asked.
Yeah.
Okay. I need to just share my screen. Sorry, let me just do that for a second.
Yeah, that's fine.
Okay. Okay, so here's the 5 questions I asked, which was the total number of your workforce, the total number of staff who've died of COVID-19,
the
total number of staff who've been admitted to hospital as a result of COVID-19, the number of staff who've been properly diagnosed with COVID-19, and the number of staff we've had to isolate, not counting when your offices were closed, because obviously a lot of council offices were supposedly closed. So the idea of asking them 5 questions, Mick, where the first one is self-explanatory and so is the second one.
Yeah.
But the 3rd, 4th and 5th are probably the other parameters that we're told that are constantly run down our throat, that the hospitals are absolutely run chocker.
Yeah.
Everyone's testing positive, and people can't go to work because that many people are testing positive. So I asked them what the infection rates were in the workplace, how many people have died, how many have been in hospital, and that was because of the program that they put in place called Test and Trace. So you would have assumed that they would have been keeping these details on their staff. So that was the idea of what I'd done. So I asked them questions to 1,392 places, of which I've had 700 replies. Well, I've got 684 that are detailed. Okay, so I've got a little spreadsheet here, which will take us through, before we get to my data, we'll take us through what the public go through, the data that they're witness to every day of what's displayed. So you've got the likes of, we'll just shoot through these very quickly. So that's what you get off the BBC. There's 58,000 deaths.
Yeah.
Okay, that's up to, I think that's up to today or yesterday. Then you've got the ONS statistics. So there's what the BBC's fed off. This 58,000 deaths from the ONS. Yeah. And this one's got more deaths on it because this is people who died with COVID on the death certificate. This people have died within 28 days of a positive test. Yeah. Nowhere on there does it say anyone who's died of COVID on its own.
No.
Okay.
And of course, we also need to, it's interesting listening to Professor Richard Ennos, who was arrested in Scotland a couple of days ago, because he said also you have to differentiate between someone who has tested positive.
Yes.
And a case, and for him, a case is someone who is currently experiencing the symptoms of COVID, needs hospitalisation and ICU treatment.
Yes.
He said everything else outside of that is not a case, because the government do quote cases, but actually what they're talking about is positive tests, which we know not to be reliable. Right?
Well, we've got government data to prove that, mate. So we can show that. So the next thing that I'm going to show you is that there is a page available for people to be able to get the links from this video. And this is a government document on the ONS website. And it's just basically giving people how to read the data if they're interested. Okay. Breaks everything down into the comorbidities and everything. You can get quite a lot from that page. Okay. So that's what data we're witness to. What we also see, or the public don't see, is the NHS deaths. They're constantly given the ONS deaths. So the NHS deaths is available on the website, which if you click there, you'll be able to download this sheet. Okay, I've already downloaded the sheet for you. So the difference between the ONS data and the NHS data is the NHS data is people who've died in hospital, and the ONS data is people who've died in the care homes and community on top of the NHS.
Yeah.
So up to yesterday, there were 40,000 deaths, say 42,500 deaths. So there's a difference of some 25,000 between the NHS and the ONS.
Yeah.
But both figures have been changed along the way. They're down to reporting strategies. That's a whole different story. But as we stand today, that's what they're reporting. Okay. So there's 40,000 people there who tested positive at the time of death. Okay. Now we're going to go into this in a bit more detail. This doesn't tell you in detail here what actually that means. And the other 1,923 as a positive test result for COVID-19 was not received, but it's on the death certificate. Okay. That's broken down more clearly when you go to the weekly report. Okay. Which is called, I call it the NHS weekly by comorbidity.
Yeah.
And you'll see, sorry, I'll have to download that because I haven't.
Yeah, that's okay. And interesting. I mean, comorbidity means something that is accompanies or an underlying accompaniment to somebody's presenting problem. Mark.
Yes. It won't take a second to get this one.
Yeah, that's cool.
I'll just show people how easy to get it. So it's just there on the front page of the NHS website.
Yeah.
So what this sheet will show is how them numbers are broken down. Okay. When I finally decide to load. Okay. If we go on to table 3. Now this is up to the 25th of November, so it's a couple of days out. But the 40,000 and the 1,900 that we've just been seeing before are actually labelled differently here. Okay. The 37,000 that tested positive within 28 days are actually people who've got a pre-existing condition.
And this is the NHS website showing you this, Mark, yeah?
Yes, yes. Okay.
Yeah.
So that's now 39,000 that we've seen before, and this one is 1,900.
Yeah.
Okay. I've got this sheet somewhere. Let me just try and get this sheet up. Okay, so is this the same one? No, that's the wrong one. Sorry. Okay, we'll just go with the one that we're on. I've actually got this section off. So these 1,700 deaths here are down as no pre-existing condition.
Yeah.
Okay, and then we've got this column here of unknown pre-existing condition. So what I'll do is I'm going to come back to that in a second, but just keep that in mind. So there's 38,000 or 39,000 with the pre-existing condition and 1,900 with no pre-existing condition. So if we go back to our little guide.
Yeah.
Okay, so then we've got the ONS by comorbidity. So this is the same as the NHS by comorbidity, but it's the wider community as well.
Yeah, yeah.
So when we open that sheet, this will give you a rundown. This is a government spreadsheet. So this is the people who've died within 28 days positive test, and they've got these conditions.
So we're looking at Alzheimer's, cancer, cardiovascular conditions, digestive conditions, mental health, metabolic conditions, etc., etc. Yeah.
Yeah. Okay. So there's 11 different. There's 10 different conditions there, and one which states no conditions at all. So I've just grouped these together, and what they've done is the group. Oh, sorry. Can we just go into the definitions? So some of the definitions that you'll see are go right up to the top: Alzheimer's, and then the cardiovascular details what comes under. If we go down to the respiratory conditions, which are what included in COVID diagnosis, you will see where it's denied beyond all doubt that they're not recording this. It's actually there. Okay. Yeah. So influenza and pneumonia, and I can speak more about that. So if we come onto this first sheet, what I've done is I've just grouped these percentages together. Now, if you go into these tables, it'll give you numbers of people who die per 100,000 with a said condition. So I've grouped all them numbers together on this initial sheet here. Mm-hmm. So these are the numbers of men and women who will die per 100,000 who've got Alzheimer's. So that's a total of 3,400 people they are estimating who've got Alzheimer's. So it's taken not from the population, but from the group of people who've got Alzheimer's. Let's say, for instance, it's, I don't know, 500,000 people, 1 million people, something like that.
Yeah.
So 3,400 people per 100,000 will die of Covid-19 and Alzheimer's. So that's how you work it out. So 336 people per 100,000 with cancer. Now there's some alarming statistics that you can pull from this. Covid-19 is a respiratory virus, so we're told. Some people would argue against that. So you would expect it to attack people who've got respiratory illnesses.
Yeah, yeah.
Okay, I've got 3 children. I've got twins in Liverpool and a daughter in Hull. My twins were born 15 weeks premature. So my son has got autistic spectrum disorder, ADHD, a bit of cerebral palsy, and chronic lung disease. So he fits into quite a few of these. I've got quite a few of these as well. So the respiratory condition, he's going to suffer from all his life. He's got chronic lung disease. When he was younger, when the season has changed, he was in hospital with the season change. That's how bad it affected him. So I kept him off college at the start because of this. Now, 558 people per 100,000 with a respiratory illness, including COPD and diseases like that, will die with COVID-19. Yet 1,192 people with a mental illness will die with COVID-19. So you are more likely to die with a mental illness of COVID-19 than you are with a respiratory illness or a cardiovascular illness. That is just absolutely bonkers. Now that suggests to me, although obviously I would say this is my opinion, that suggests to me what people like UK Colin were quoting all the time: the lockdown deaths, is the suicides.
Yeah.
It jumps off the screen because it's the second highest one behind Alzheimer's. Alzheimer's is the #1 comorbidity to COVID.
And of course, interestingly enough, when you look at the ONS at the moment, you can't get any up-to-date stats around suicide. They've told us that they're delayed.
They're being withheld, and that's obviously the reason.
Yeah.
So let's go back to our little guide again. Link sheet. So the comorbidities and the elderly are what the main factors, and elderly with comorbidities are more at risk. Also, we're told. Okay. Now, if you imagine a seesaw or a pivot with people on either side, you need like 30 or 40 people over 80, 85 to die to make up for one person under 40.
Yeah.
Because every time someone young dies, you need to pile loads more people on the other end. Okay.
Yeah.
But the average age of someone dying of COVID-19, right, which again is another ONS document. When it decided to come up. I've already got it up, sorry. Okay, so the average age of someone dying is 83. The average age of someone dying of a general death is 81.5, 81 and a half. Right? I think there are reports that this is 82.4, but it's somewhere between 82 and a half and 83. So people with COVID-19 statistically live a year or a year and a half longer. Okay? That would suggest on a statistical basis, seeing as that's what the government used to lock us up, that elderly people are not disproportionately affected and are just dying, but are tested positive for COVID-19.
Yeah.
That's where the problem lies. Okay.
Yeah.
Back to our little guide. Okay, we've done that. Now, what you were saying before about the positive tests, on the, I think it was the 19th or the 22nd of March, it was announced in the 26th of March in the Commons that COVID-19 was downgraded from a high consequence infectious disease to a notifiable infectious disease. Now, the reason for that is because there are not enough hospitals in the UK to treat what the suggested influx of patients was suggested to going to be with HID. I think there's only 4 hospitals that are able to deal with them. So therefore, it had to be downgraded for them to be. But that comes with different parameters of downgrading it. So when you look now at all the positive tests that you've just been talking about, Michael, what is it now? I don't even watch the news, to be honest. Is it something like 25,000 a day?
Well, the challenge that I have is if you look at the evidence of Professor Carl Hennigan, you wouldn't really believe in those tests. And equally, if you look at all of the thousands of scientists that are currently being censored and silenced, then there is no alternative narrative anyway. Okay. There's no counter to the narrative, but I have no reason to believe that they're reliable. Even Boris himself, when you look at some of the videos that have been put out there, Dr. Raab, they've told you that they're not reliable and the likelihood of false positives.
There's a peer-reviewed study gone in today. I think it was done yesterday. Have you seen it by Mike Yeadon and stuff?
Mike Yeadon, absolutely. Who used to be one of the main people in the chief scientific officer of Pfizer.
Yeah, well, they've done a peer-reviewed study today. I think there's about 20 world-class scientists, Claire Craig, Mike Yeadon. There's a whole host of people on there about the validity of the PCR test. But,
and I think also, Mark, what prompted that was somebody fact-checked him, didn't they? He was censored and fact-checked. So he decided to take Facebook, Twitter, and a number of other social media platforms to task over it.
Yeah.
Yeah.
But the doctor you mentioned at the start with the difference between the cases and the positive test.
Absolutely.
With COVID being downgraded from HCID to NOID, it goes on to a different report, which most people don't look at, but it has been sort of published widely on social media this week. So the sheet itself is called the Notifiable Infectious Diseases, and here it is. So again, this is another government spreadsheet, okay?
Yeah.
There's COVID-19. This is for last week, week 46. There was only 87 reported cases, not deaths, cases.
Yeah.
The week before was 127. So this runs along all of these notifiable conditions.
Yeah.
So if you can see the likes of something that I think we spoke about last time, measles and mumps. It was something to do with it was I think one of the diseases. I think it's mumps. Yeah, mumps. Or anyway, one of the diseases has gone absolutely through the roof, and it was showed on one of these charts. But as I say, COVID-19, 87 cases in a week. The week before was 127. So what's the clinical definition between a case and a positive test?
Absolutely.
And I think it is the hospitalization and symptomatic needing medical attention, which
Absolutely.
is what these 87 confirmed cases are.
Well, that was the premise of protecting the NHS from the off, wasn't it? How many beds are likely to be taken up by what they called cases then, but actually they're not applying that logic anymore.
No. Well, the NHS bed availability is not really true, is it? Because it's only based on the allocation that they're giving out at any one time. So a hospital may be running at 99% capacity availability, but of 80% capacity.
Yeah.
So they might still have another 20% capacity, but they're just not declaring it.
Yeah. Well, the interesting thing from that is when we start to look at the numbers of beds, there's nothing unusual for this time of year. And if you look at the Nightingale hospitals, that's a different story, isn't it? If you look at their usage and actually the fact that they're now being decommissioned.
Well, they've obviously been built for a different purpose, and I've said that since day one.
Yeah.
We won't get into that though, because it's different.
No, we're getting to the world of imagination. So let's look at the facts of what is really going on and look at the facts. That's the main thing. Yeah.
So I've showed you how I knew about it, what I've done, the answers that I got back. So I've had some of my data published, and it was published by the UK column.
Yeah.
Who
what were their main findings, Mark?
Sorry?
What were their main findings from your paper?
Okay. So I'll just shoot onto the ONS published this ASMR of 16.6 people per 100,000. Okay. So we'll go down to some of the data here. Okay. This is some of the data that we pulled from an analysis report from the ONS. So the main one that I focus on is this: 48,168 deaths were due to COVID as it was identified. This was between January the 1st and August the 31st.
Yeah.
Okay. So people need to keep in mind that the ONS is a predictive model. It's based on previous events plus a forecast.
Yeah.
We have no previous events of COVID, so therefore they've got no previous events to go on. So if we look down here, of these 300 COVID deaths here, 448,000, 18,642 of them, right, had influenza, pneumonia, and COVID on the death certificate. Okay, so what's known as IPC deaths.
Yeah.
Being reclassified under the International Classification of Diseases, ICD-10. So 95.8% of all of those cases were given the cause of death was given as COVID-19, even though they had influenza and pneumonia on the death certificate.
Yeah.
So that's something like what, 95 to 18,400, something like that. That's to me, I'm not a scientist or a mathematician, but I'm quite clever. That's to me statistically impossible. Okay. No, he's worked it out there. 0.004% recorded influenza and pneumonia as underlying. So out of all them, 0.008 were given influenza and pneumonia, whereas in previous years it's something like 13,000. Yeah, so there's no the numbers that are dropped off previous years are quite easily accountable for with COVID-19. You know, the similarities are unbelievable. So what Ian worked out was that the population of England, according to the census, worked out the working population at 36.7 million people. Okay. He's also given account for growth since the last census, so he's got it more or less spot on. So then we've calculated against the government's 16.6 people per 100,000 amongst the under 65s, because we can take children out of it.
Yeah.
My ASMR that I got back from my 700 freedom information requests was not 16.6 people. It was, at the time this was published, it was 4.6, and it's now down to 4.2, 4.3. That means that they calculated that the death toll for these people was 6,092, which is included in their estimate of total deaths. Okay. Now, mine gets it down to 13,000, a figure which we've just spoke about before.
Yeah.
Okay. Now, there's a discrepancy between this figure and this figure of around 34,000 deaths.
Yeah.
Now, Ian points out this is a figure which he has mentioned before. Now, I only spoke to Ian in August. I started collecting this data. Sorry, in September. I started collecting this information in August.
Yeah.
But Ian wrote about this in his own blog, which I'll just show you, in June. Okay. And okay, if we look on here, so of the 46,000 deaths that are suggested, again, going on to COVID and flu, and there's a gap of 33,500 people. Now, that was in June.
Yeah.
This article was written in August, in October, and the gap was roughly the same.
Yeah.
So that gap has tracked right the way along until recently, where they've started to kick this PCR test back in and start proving or trying to prove loads of people dying of COVID. That gap of 34,000 has been static for months. It's something which I thought would continue, but it's just fell apart recently. So that's something that I've stopped.
And of course, Mark, if you look at the study that was done with King's College Hospital in London, they also suggested that because of the blanket do not resuscitate policy that was put out, that anything up to 60% of people that presented problems never actually made ICU anyway. So when you start to look at the overall numbers of deaths, these are confounding variables, aren't they?
Well, if we look at Ian's article here, which is something that he's covered in the article he's done for me, this was from Italy, from the Professor Walter Riccardi, who was the Minister of Health. After they done autopsies, only 12% of their deaths were a direct casualty of coronavirus.
Yeah.
Right. So then we've got Valence, which I've got on one of my videos, saying that it's important to remember that people have got the COVID on the death certificate who've never been tested. My opinion is this 34,000 deaths that I was tracking were the lockdown deaths from the care homes and the community.
Well, if you look at the opinion, if you listen to the opinion of Carl Hennigan, he suggested that if the care homes had been locked down just for 9 weeks and they'd restricted access the way they should have done, that up to 40% of those deaths would have been stopped.
Correct. Now, there's what you were on about before about the blanket DNRs. There's also the what Ian's wrote about here, which was the MCCD, the medical certification for the cause of death.
Yeah.
Now, this was changed. This was changed in around the time of Harold Shipman to stop them atrocities happening again.
Yeah.
Something which is spoke about on various independent news channels, and UK Column being the one. I'm not plugging them all the time, but they've done a lot of work. And they were changed so that these things weren't allowed to happen again, but them controls were taken away for COVID-19. So doctors were allowed to sign death certificates with COVID-19 on them without the verification of another qualified person or speaking to the family, speaking to the family for any undiagnosed conditions and anything like that. That's all gone. And a doctor can diagnose someone that's dying of COVID-19 over the phone without ever meeting them.
Yeah, I know. And we're getting a number of people talking to us on that level, Mark. Yeah.
There's reference again to what I was on about before, about the international classification of diseases. Changes were made, quite a lot of changes were made in that as to the classification of COVID and also the MCCD thing. So there's plenty of what you wouldn't call it hard evidence, but you'd call it suggestion that this has been done in a deliberate manner. Okay, so let's get back to our sheet. Get to the data. So when I said I had an ASMR of 4.4%, here is the data which I gathered, which I'll talk you through. Let me just...
Because I mean, the number of requests you made, Mark, because you have these 5 questions, but how many actual information requests did you make?
I made 1,392.
Wow.
Okay. From that, because that database that I used, the FOI one, it's from 2012, so it was quite old. But from them 1,392, I got 1,000 acknowledgements. About 300 or 400 were old email addresses and where NHSs have merged and stuff like that. Yeah. But I got 1,000 true results. I've had 1,000 acknowledgements. So some people are some are duplicates. So I was expecting between 800 and 900 back, and I've had 700 up to now. I've got a couple to process. Yeah. So I've put 674 recorded here. So I'll just talk you through.
In terms of sample size, Mark, that's pretty profound, mate.
It is. So I'll talk you through these numbers so people understand. So this cell here, what I have hovering over, that's the number of replies that I've had. Okay. Yeah. This is the total number of staff that I've surveyed, which is 2.4 million. Okay. Of those 2.4 million, there have been 105 deaths. They're recorded, but then again, they've been diagnosed, may not have ever been tested. They've just got it on the death. We're still into that ground. So there's 482 hospitalizations out of 2.4 million people. Right? There's a reason for that. There's a caveat in the data, but I'll explain that. Yeah. 21,000 positive tests and 310,000 isolations. Okay. So the little legend that I've got down here just indicates the questions, which was the number of workforce as a whole, the deaths, the hospitalizations, and that's color coded to the columns. Okay. When the data's come in, what I've done is I've stored it as such. Okay. I've got in this column here, in column A, that's the email address or contact details for where it's come from. Yeah. In B, okay, what I've got in here is an actual copy of the official reply. Yeah. So sorry about that. If I go onto here and click on Edge Hill University, I used to go there. It's mad the way I used to always click on things. So if I click on Edge Hill University, then it will open up, on my Outlook's not open, so it'll just take a second. What it'll do, it'll open up a copy of the official reply together with all the domain names, so you can obviously understand. So there. Yeah. Okay, so it's from Edge Hill AC UK, all above board. The 5 questions with the 5 answers. Okay. Yeah. And it should be as simple as that. Thank you very much, Edge Hill University, for answering the 5 questions. So they go into what's called the data complete category. Okay, which is signified here. And that just tells me that they've answered the 5 questions. Yeah. And that data is complete. So part of what I wanted to do was to measure all of these numbers because they should have a system in place to test and trace. And these 241 people, if you notice here, we've got data complete filter. Yeah. Those 200, there's another one to go on there. So there's 240 that have answered all 5 questions. Yeah. And there's 433 that haven't. Okay. So if we take the 241 as a given, that's all clean data, then we'll move on to the 433 that didn't give an answer. Now they may not have answered one question, or they may not have answered two or three.
Yeah.
Most of them have not answered two or three. Okay. Some have not answered one, some have not answered all. Okay. So on this is signified again by the red N, which tells me that they haven't answered the data. And then if I blow this up a little bit for you, what I've done is, where I showed you Edge Hill's comments before, Edge Hill's reply. If I go into I just pick these at random. So University of Huddersfield. And you'll see, rather than answer me, they give the university's central system records staff nickname, but does not categorize specifically for COVID-19. Okay. So therefore, they've had to go down as a 0 with a copy of that answer.
Yeah.
Yeah. What I've done is I've copied that and pasted that as a comment in the cell.
Yeah.
Okay.
Yeah.
So that means that anyone looking at it can just hover over the cells.
Yeah.
And see what the replies were. Save open all the documents, but the documents are there as a backup. Also, what I showed you, last time we spoke, is I've also that's all this is all the FOI replies that I've had. Yeah, so they're all in a folder. Yeah, and then I've also got, in case there's ever any doubt, a full copy of all the transcripts of the emails.
Yeah. So you can prove every interaction.
Every single one.
Fantastic.
Okay. So where was I up to? Yeah, so we're on to the comments. So they're the comments that I get back. Now, on this death data, yeah, you'll see these comments here that say less than 5.
Yeah.
Okay, and there's another one there. Okay. Now, if we put a little filter on this data, so I can just show you how there's been 16 instances of this happening. So that one. And if we go up there, you'll be able to see. Okay. So it doesn't really matter where they've come from, but you'll see that they all answer less than 5, less than 10. Now, as part of freedom of information, they have to tell the truth.
Yeah.
I'll say that initially.
Yeah.
So if the answer is 0, they should state 0. Okay. Where the answer is less than 5, you would logically expect the answer to be between 1 and 4.
Yeah.
Where it's less than equal to 5, it could be between 1 and 5, and less than 10 would be between 1 and 9.
Yeah, absolutely. Yeah.
Okay. So therefore, where they have quoted that, yeah, if I take this, if you look here, just let's skip back over here. I've left them in as zeros, okay, but I've also accounted for them here.
Yeah.
Okay, so we've got 16 instances. I've give where there's less than 5 and less than equal to 5, I've given them a minimum value of 1, and so in here I've give 14 instances of 4 and 1 instance of 5, and then on the less than 10, I've given a minimum value of 1 and a maximum value of 9, and then I've accounted a separate death percentage ASMR, yeah, for with a minimum value and a maximum value. So it's not like I've left them out. I haven't just left them out. Okay. So this number I have here says that 4.362 people, so 4.3 people per 100,000 within the government die of COVID-19. Yet the ONS are saying 16.6 people of the general public are dying of COVID-19. So there's either a massive difference between what's going on, or the government staff have got protection, which obviously that's not true. But only one of them things can be true.
Yeah.
There's a difference in the data, and it's down to the way it's collected. Okay, so these less than answers are given. They give their exemptions. Okay, and their exemption is that the number is so low. First of all, the number is so low signifies that it is a number. 0 is not a number.
Yeah.
The number is so low that revealing that number, whether it be 1 or 2, might reveal might lead to the identification of the person or persons involved.
Yeah.
And there's several instances of that throughout there. So what they're saying is that they don't want it to lead to the identification of individuals, which is fair enough. But that's under normal circumstances, but we're not in normal circumstances.
No, we're not.
There's £12 billion being spent on the track and trace system. 241 places there have answered all 5 questions. So there's obviously something in place to make them answer it. They're not going to decide to answer it randomly. Okay.
Well, and it also makes you wonder, Mark, just how efficient the system for reporting is anyway.
Well, I'm gonna show you now.
And recording, yeah.
So these exemptions, you would expect the answer to be between 1 and 4. So if we take a look at them, I'm going to show you an example from Oldham Council. Now, I pick this out all the time, and I'm sorry, Oldham Council, if you've done it wrong, but that's not my fault, that's yours. So if we go and search for, let's go in. Oldham Council. Sorry about this.
That's all right, mate.
Okay. So what Oldham Council are saying that they haven't used less than 5, but they've used the number is so small. Okay. Yeah. So the council cannot provide a figure for this, as any response could potentially lead to the identification of individuals and their personal information.
Yeah.
But this does not mean that there have been instances. Okay.
Yeah.
Now that is a complete and utter paradox, or oxymoron, whatever you want to call it.
An oxymoron, yeah.
All them type of things. 2 things can't be true.
No.
It can't be a number and nothing.
Yeah, there's either one or the other, right?
Yeah, so therefore...
No deaths or deaths.
That's the reason, Michael, why I've made the calculation the 3 ways that I have.
Yeah.
Okay. And also I've got, which me and you've discussed about getting other people involved. I've got now some people looking into the legality of these answers.
Yeah.
And whether or not, I'm working on a system now to get these answers indexed so I can draw statistics from them.
Yeah.
Which is going to be marvelous. Okay, so that's that exemption covered, and the debts. There's also some exemptions for other reasons. Some say that the information is available elsewhere, like on their website.
Yeah.
Now some of them are quite easy to find. You go on the website, go on a link, and it's there. Some of them in an annual report from 2019 on page 64, and you have to download the PDF. It's just ridiculous. To ask the number of staff that work for you, you should just be able to say 25,600. It should just be on the top of the head.
Yeah.
But maybe that was a deliberate stalling tactic. It didn't happen often, but it just seems petty.
Yeah.
Other ones that the information wasn't in public interest. And these are the actual exemptions that they use, and the answers that they give are a different thing. Other ones is that the information is due for public release in the future, but no date needs to be set for that publication. So
what I find interesting at the moment is we've made a number of freedom of information requests, and they've literally been denied.
Okay, if you had the letter through that to say that they've been knocked back.
So basically, they've been denied.
Have they answered you to say no?
Say again?
Have they answered you to say no, or just not answered?
They've just not answered.
Okay, yeah, there's quite a lot of them.
Yeah, and we're finding that's a current pattern, and it runs in line with some of the observations of other people that are talking to us.
Well, I've sent 3 this week, and I've sent 2 of them originally from a personal email account, and then I never got no answer, so I sent them 2 and another 1 through What Do They Know, and I got an answer within hours. Well, I got an acknowledgement within hours, and they were all to government departments. So maybe that's the way to go.
Yeah. So and what is that called? What Do They Know?
What Do They Know? Yeah.
Right. That'll be good advice for us to give to others, because there's a number of us that are tracking what's going on out there.
They have templates and that set up, and they have FOI email addresses for organisations already within the system.
Yeah.
It's probably more up to date than the system that I used. I've sent them an email asking them for some assistance with some problems that I've got, but I've had to apologise because I didn't use their system initially. But I just went with what I could find.
Cool.
So anyway, let's get back to these exemptions. So there's all sorts of exemptions, and that, as I say, I'm trying to get them quantified. But when we get into the answers themselves without exemptions, then that's a different story. Okay. And what I'm talking about here is these three columns, which is what you would consider if these 241 places have answered those questions and quite seemingly have a system in place. These 433 don't seem to.
Yeah.
Now, the answers where they don't use an exemption range from basically, we are not keeping this data, no information held.
Yeah.
Okay, let me just skip over so you can see these. I'll blow it up a bit. So, again, these are just purely at random. Information not held. This one's about hospitalizations. I'll explain about that in a second. Yeah. This one's about properly diagnosed. So we do not record this information. I've said properly diagnosed without requiring hospitalization. So there is a slight caveat on the question, but a lot of them have used that sort of little get out clause to get around the question. But even so, that the answers just keep saying information not held, unable to advise due to low numbers. There's that answer again. Let's just see some more. So this one's using an exemption. So there's quite a variety of people using exemptions and then just saying information not held, not tracked.
Yeah.
If we can go to a couple of more of these examples, okay, and they are one-offs, but they show you the absolute lack of what you call any sort of infrastructure.
Yeah.
So when asking them about isolation figures, Harbour Council told me that they're no longer held by the council because they've deleted it, as per council's data retention guidelines. Now, it's my understanding that data should be kept for 6 or 7 years, but maybe coronavirus guidelines have changed. We never know. So there's answers like that. If we go to the contentious replies, I can't remember the one I picked out last time we spoke. Was it Cardiff and Vale?
It might have been Cardiff, yeah.
Let's just see if this comes up. I don't think it was this one. But we'll see. It's I have this problem with PDFs opening all the time.
Yeah.
Let's just see if we can pick. Yeah, there we go. We're on. So let's just get that out of the way. Oh, this was the one that I showed you that wanted to make a nice big chart of, this is look at this. Look at this.
The numbers above represent tests undertaken for staff and their family members. Individuals may have undertaken more than one test. The numbers of PCIC include tests undertaken for staff and their family members employed by the primary care contractor services, as well as those employed by the UHB. So
you understand what that's saying?
Go on.
The NHS staff testing numbers are including family members.
Wow.
Black and white, mate.
Yeah, absolutely. It's there, isn't it?
And I've seen that many of these with that many different absolute bizarre things on that I can't keep track of them all. So I just picked these out, as I say. I've got these in a little folder, so I just saved contentious things to one side. So let's see if we can pick out another. Let's see. We won't go through loads. Let's go for, I don't know, Gloucestershire City Council, Gloucestershire County Council. So I can't. Oh, yeah. So we don't know specific information for properly diagnosed, only symptomatic.
Wow.
So where is test and trace in these public workplaces?
Yeah. How can you possibly say that the numbers being tested are precise?
It's ridiculous. It's absolutely ridiculous. And
Absolutely. I see that.
I've got 433 of them.
Wow.
Okay. So we don't need to spend all day analysing them all and ripping councils to bits because
no, I think, but it just emphasises the fact that that what people think is going on compared to what the reality of what's going on, really, Mark.
So this is what I call my navigation page, mate.
Yeah.
So what this is a summary of each sector, the 25 sectors that I've surveyed. I think we showed this at the beginning when we had our last conversation, but it doesn't matter which order they go in. So as you can see, I've grouped together the city councils and pulled together the key stats from them. Okay, yeah. This number at the bottom is that number represents 4,000 of 1%.
Yeah.
Okay, that means 4 people in 100,000 are labelled as dying through COVID-19 within city councils in England, in the UK. Okay, but then people may not have. We'll come on to this in a minute. May not have died of COVID. They may have died of comorbidities or influenza or flu, as we explained before. So you can see the numbers. That's 4 in 100,000. That's 6. That's 2. That's 5. That's 2. That's 8. That's 5. It's ridiculous. Okay. So let's move on to the actual alarming ones, which is everyone's locked up, and you can't go out. And there was a big argument in the summer over the vitamin D and blah blah blah, and people need to be outdoors. If you look at the people who work outdoors, with the exception of ambulance drivers, because they have so much contact with sick people.
Yeah.
Okay. If you look at the national parks, the police, and the fire authorities, okay, there isn't a single death across those 3 services across the whole of the UK. Now, that one death that you can see there, quite sadly, is a police officer from the Ministry of Defence. So I'm not classing that as in the normal police service.
No, they're doing a completely different job.
Okay, so those 3 front-facing public services that have more interaction with a different wide variety of range of people on a daily basis, especially the police, right? Yeah, I've got no deaths.
And especially, we work with the Met Police, and we sent an FOI request out to the Met Police and found the same.
Yeah, well, I've got the Met Police. I've also, these numbers I've got here, 128,000, are based on individual constabularies. So for instance, if I click on here now, it'll take me to the police force's page. So that's just police force data. It's all filtered off. Okay. So there you've got your police force data with all your summaries in it and the AS.
And these guys are interfacing with thousands of people, Mark.
Yeah. So there you've got 21 hospitalizations out of the whole of the police force.
Wow.
Now, I sent this out, for a friend who was having an argument with the chief constable of Merseyside Police. So she wanted to send him some data. So I sent them this sheet. A week later, 44 officers were in the Liverpool Echo reporting as having COVID.
Okay. Yeah.
Right. Okay. So the police's I don't even know how to say that because it's not 7,000, it's 10,000.
Yeah.
Right. It's 0.7 of a person per 100,000.
Yeah.
It's mad. Okay. Yeah, that's right. 0.7 of a person is 128,000. So that's the police and fire data. Another thing that I want to pick out is, which we've spoken about before, mate, is the sad tale about the universities. Students have been locked up in their halls of residence, not able to go home, see their families.
Yeah.
They've been absolutely shanghaied, to be honest. There's data from 106 different universities throughout the UK. Okay. For a total of 332,000 staff, being tutors, professors, cleaning staff, kitchen staff. So, some have just give teaching staff, some have give cleaning staff, but it's on a whole, it's the numbers that they've given me. Okay.
Yeah.
6 deaths, which comes to a total of 1.8 people in 100,000, again, who are not confirmed to have died of COVID-19.
Yeah.
They've had comorbidities, and it's a sorry story when you've got students are being incentivized to go and get PCR tests.
Yeah.
Passion boards, whatever, there was, it was all over the news. it's unjust. It's unjust to be locking them up when the numbers are there.
Yeah.
You know, again, it's freedom of information. There's 106 different sets of data there. And again, the universities, there was how many's here? Look, so this will count on the bottom. So there's 24 who've answered the questions. So again, 24 places that have got a system in place to track data.
Yeah.
On this hospitalisation data that I was saying before, places of work are not usually meant to keep that. They're not required to keep it. Okay, but from a member of the public's point of view and someone who's done this report and with the confirmation of many doctors who have spoken to, you would expect these public workplaces to want to know people who've been in hospital or in hospital. I currently live, and Michael, you know, I'm not glorifying the situation. I live in a hostel, you know what I mean? Now, when this pandemic happened, there was people coming here from prison and from a hospital.
Yeah.
And I was questioning why they weren't getting tested before they come in.
Absolutely. And
now the system, now these places, they seem to have this data in place. They want to know, okay, whereas the others don't. Now, is this a requirement, or is this something that they do voluntary?
Yeah.
You can't even argue that it's the smaller places, because some of these places have got 5, 6, 8,000 staff.
And I think you'll find that with all establishments that are publicly funded or publicly accountable at the level of the Quality Care Commission, I think you'll find that they're supposed to have these systems, Mark.
Well, when we go back to my little link sheet, mate, we'll come on to the last thing that we need to get onto, which is what covers all this, which is military data. Now, for people who don't know, the coronavirus, it's called surveillance, coronavirus surveillance. Does it mean cameras? Yes, part of it does later on as how they monitor it. But pillar 1 is mainly NHS testing. Pillar 2 is, as I've got on here, this is again, it's a government, it's an image from the government sheet.
Yeah.
So it's virus testing for the wider population, including public sector key workers. Okay.
Yeah.
And this is being run by Lighthouse Laboratories, who are owned by AstraZeneca, GlaxoSmithKline, a couple of biocentres, a couple of universities, Public Health England, and they're all part of the same team. And they're basically, it's their job to, the PCR test is to process them and to monitor all the data. And part of track and trace is obviously to monitor people who are testing positive.
Yeah.
But if I go back to my data, I can pull you out scores of places who are saying that they've got no tracing system in place for people who've got who've tested positive. And there's actual answers in there. One of the answers which I brought up last time, which it's in there, but it's rather than, I only picked them out at random, so I'm going to take some notes after this one and keep the good ones out.
Yeah.
But one of them suggested, if you remember, that they don't have a separate Covid-19 sick register. It's just included with coughs, colds, and flu.
Yeah.
These are government replies, you know, and
the
wide variety is bizarre, but the amount of them is seriously needs answering. It really does. It really does. So I've got I've got people now who are now looking to peer review this, and you've offered me some help as well.
I'm going to give you access. If you send me all your stuff, I'm going to give you access to a statistician, because what we also want to do, Mark, is interrogate it for the answers to other questions, because it's probably the most comprehensive, correct me if I'm wrong, probably the most comprehensive study that I've seen for freedom of information requests, which does not get any more factual. No.
Yeah, the everything's there, but all the information which we've gone through is everything, every single bit of data that we've looked at today has been supplied by the government.
Fantastic.
You know what I mean?
And that's great. And Mark, what we'll do is, I'm going to crystallize this session down to a number of areas that I am interested in, so that we can, compare that to what the UK column found as well.
Yeah.
So Mark, what I would like to say is thanks ever so much for doing this, because this has got to get out there so that people can actually see the facts.
Yeah, well, UK column are actually doing a second article on it, Michael, just before we wrap up.
Yeah.
And you know, it's going to be a more in-depth look into those answers that we've just discussing. And through the work of that's going to be happening with the statistician, because obviously you're connected with the World Freedom Alliance, and the exposure that I've got recently through the UK Medical Freedom Alliance, because they invited me to them, are obviously working hand in hand with the World Doctors Alliance. Everything's coming together nicely, especially for me. And you know, with everyone from our place, I say, to wishes everyone in your place well. But obviously, we once we all sort of come together on this, there's some fantastic pieces of work that have been done. Aside from what we've been talking about today, which if it's all collated together, can make a fantastic case for for where we want to be.
Absolutely.
I suggest, the division that we see at the moment is ridiculous, and it needs pulling together, because it's about a bigger thing than individuals,
and it's about bringing out the facts, Mark, right? And let's be honest, and let's be transparent, and let's have counter argument. You know, democracy is renowned for being the home base for debate. I have yet to see one academic debate that's been allowed to challenge what we call the mainstream narrative.
Correct.
You know?
But you only have to watch Question Time every week to see that, mate.
Yeah, absolutely. So that's great, mate. I think we can sort of wrap it up there for today, but I have no doubt we're going to do a short one on interrogating your system for a few more bits and pieces that you can provide for us.
Okay, no problem.
Okay.
All right, thank you very much.
Cheers, Mark.
See you soon, mate.
Take care.
Bye-bye.